The trauma team is handed a young athlete who may never walk again. A father drives by the car wreck of his own daughter.
I pulled over to the side of the road when Victoria was in the ambulance coming down, and I didn't know it at the time. It was so close to home.
Now the trauma doctors must act quickly if she's ever going to go home again. A young family might lose their eldest son, a teen victim of a stabbing. Tragedy plays no favorites, and the young are not immune. For the doctors and nurses of the trauma team, trying to save a young victim's life is at once the most rewarding and the most devastating part of the job.
As a trauma team member, I think the worst thing that can happen is that you lose a young person. So you work on them furiously, and when they live, then it's okay, let's get on with life. But you know how close they were, and that you just gave this 15-year-old another 70 years to live. That's the best feeling for sure.
At St. Michael's Hospital, they rushed the young victim of a bizarre accident into the trauma unit.
Healthy girl. So there was a bunch of people on the balcony. She was the only one that was injured.
Minutes before, Chrissy Molnar, a brilliant athletic 25-year-old, stood on a balcony deck sharing drinks with friends when the unthinkable happened. The deck collapsed. Chrissy plunged 14 feet to the ground below, with furniture, her friends, and the deck all landing on top of her. The extent of her injuries is a mystery.
And she has pain that shoots up and down. Mostly her left leg. When we found her, she hadn't moved. No medication appointments here, gonna get her better.
She really is a fighter. You know, she was a champion-level cross-country runner. She, when she graduated from St. Lawrence College, she was the Female Athlete of the Year, and she also won all of the academic awards too.
Chrissy lies on a gurney, her friends and family anxious for word of her condition.
Right now, I feel like a lot of pressure in my lower, like my middle back.
Chrissy is clearly alert, but for someone in a lot of pain, the team notices she doesn't move very much. And a routine question gets an alarming answer.
Okay, but what about down here? Can you feel me?
I don't know. Wait, I don't. What are you feeling?
Can you feel me doing that?
I don't know what you're feeling. I feel that.
Can you push my hand? Push my hands up. I'm pushing on your feet.
What foot?
Both of them. Lift your toes up to the sky. Yes.
She may just be in a temporary zone of paralysis, a paralytic shock. Or could she be paralyzed for life? Dr. Chen's focus is clear. He needs a neurosurgeon in the room right away to help find the answer and try to keep this promising young athlete from facing life in a wheelchair. Uptown, traffic slows to rubberneck at the fate of an 18-year-old girl, Victoria, too young and too innocent to be hanging by a thread.
Approximate length of loss of consciousness at the scene was about 20 minutes.
Young Victoria Less has spent the summer working to save money for dental college. And a tough day at work for Victoria goes from bad to worse. Picked up by her boyfriend, he falls asleep at the wheel. The car spins out of control at an alarming speed.
She's got a facial smash.
How?
Open her mouth.
Did you have any loose teeth before?
No.
This is loose here
Okay.
too.
They all came out when I had the accident.
Yeah? Okay,
Yeah.
good. Didn't swallow any? The car was at high speed, rolled over several times. She had her seatbelts on, actually was hanging from the seatbelts when the paramedics arrived.
In a strange twist of fate, Victoria's father was witness to his daughter's horrible accident.
I drove right by the scene of the accident, and actually I pulled over to the side of the road when Victoria was in the ambulance coming down, and I didn't know it at the time. It was so close to home. And then I went home, sat down for maybe a minute or so, and then I got a call from the police officer to inform me that Victoria had just been in an accident.
She was hypotensive, about 80 on 50.
Question is, why is she hypotensive?
Victoria's face is horribly smashed, but the team is more concerned about injuries they can't yet see. Her blood pressure falls while her heart rate climbs. These conditions are a clue, pointing to a potentially lethal internal bleed.
Will you put me out?
So guys, it'll be bleeding until proven otherwise, okay?
Yeah.
Right.
So you should call. Is that a real heartbreak? I just wanted to see what this one was.
Yes? So far for us here, the heart rate's very high. I'm trying to figure out why exactly. For us, mainly, is it bleeding? That's the main thing. Why did she have that low blood pressure initially? And why is her heart rate high?
These conditions are life-threatening, and the team still doesn't know what's causing it, so can't stop them.
My worst nightmare. Yeah. Come on.
If they can't find out in time, her young life will be cut short. A normal shift at a tool and die shop turns tragic for 16-year-old Tim Malingas. A misaligned piece of metal from a press fires off, ripping into his neck like a bullet. Tim's throat instantly becomes a bloody pump, draining life from the young teen's body.
I heard Tim screaming and yelling, so I turned around and he was tearing his pants off at the time.
Instinctively reacting, Tim used his own track pants, tying them around his throat to keep pressure on his wound, keeping himself alive long enough for his co-workers to get him to the hospital and into the hands of the trauma team, who now have to figure out what the virtual bullet has done to Tim's neck if they are to save his life.
Is this over here?
Trauma team leader Dr. Alametti needs to figure out what damage the piece of metal has done to Tim's neck, and if he can stop this boy from bleeding to death.
I go to surgery. I want him to put out.
Are you in a lot of pain right now, or are you just scared?
I want him out. That's it. Am I gonna be all right?
You're doing well here.
Good enough. Okay.
Till now, Tim's bravery has been uncommon for someone so young, but his emotions are now tested.
Looks like it was a lot of bleeding.
Yeah, it was soaked when it came in.
Okay. Can I have more gauze?
Can you bend this one?
Their exam is cut short by an increase in Tim's bleeding.
You okay? For now. I'm just a little scared. I'm so worried right now.
With Tim's high anxiety comes a high heart rate, and blood pressure so strong it bursts the clotting wound like a steam valve.
Okay, let's go.
And then upstairs.
Against normal protocol, his older sister is brought in. The hope is that she'll help calm his heart rate and slow the bleeding. Her kiss on the forehead gets immediate results. Tim's heart slows down. The team can now get back to finding out where the metal fragment is and what damage can be repaired before it's too late.
To exclude that there is no major vascular injury, so doing CT scan would be a good idea to plan ahead what we're going to do exactly.
I'm going to go up to a CT scan.
All right, can we move to CT?
We need more blood from this man before we go anywhere.
The team can't stay blind any longer. They've got to rush Tim to CT to get the detailed look inside his neck that they need.
I love you too.
Elsewhere at St. Michael's, Dr. Chen and his team hope against hope that the deck that collapsed and crushed young Chrissy beneath it has not left her paralyzed for life.
But I more or less heard this tearing noise and then felt... And I remember being like this for a minute and going, what the hell? And then bang! And all the girls had fallen on each other. And she was screaming, I can't feel my legs.
Another 18.
The 25-year-old star athlete can't move or feel her legs, and the team needs to get a closer look for possible signs of whether the damage is irreparable.
What we're going to do is we're going to roll you onto your side. You're going to feel me feel along your back, and you're going to yell. Yell as hard as you can when something hurts, but don't move. Okay, you're allowed to yell as loud as you want.
Okay, we're just doing this one set. You're gonna be fine. Okay, we just need to know.
I'm just a wimp, I know.
No, you're not a wimp. You're doing fine. You're in pain, right?
I know.
Okay. 1, 2, 3.
No, you let us do the work, Chris. Let us do the work.
Not that bad.
You're going to feel a little bump as you come off that hard board.
Please help me over, please help!
You're going to feel me in your back. This is me. I'm feeling in your back.
Chrissy's heart-wrenching cries cannot stop the team. They must continue if they hope to help her.
1, 2, 3. Okay, done.
Where? Tell me, Chrissy, tell me where.
Right leg. Ow.
This sudden leg pain sounds awful, but it raises hope. Could Chrissy's spine be coming out of shock, like a limb that's fallen asleep coming back to life?
Tetanus shot as well, please.
Not a big step, but a lot of swelling and deformity, and there's also a little bit of crepitus around that too.
A young woman with the whole world before her, slashed down in a matter of seconds. It's practically unspeakable, and the team is eager to share their glimmer of hope with the neurosurgeon.
When I examine her, she's awake and alert and everything moving up her limb, and certainly no motor to either leg. When I look at her back, there's some swelling.
What time was that?
Let's say 20 minutes ago, 15 minutes ago.
15 minutes ago was the accident?
Yes. So she's fresh.
That's good.
The accident is less than 20 minutes old, and that's a good thing. Even the neurosurgeon is hopeful. Swelling in Chrissy's back could be the main culprit behind her inability to move her legs. The tests they'll do in the next few minutes will determine if this young long-distance runner will ever walk again. Just minutes ago, a summer party turned tragic. A deck gave way beneath 25-year-old Chrissy Mona, plunging her to the ground below, then crushed by falling beams and furniture.
But the swelling's about that big around, and it's exquisitely tender. Okay. So high spine.
They have
the trauma team at Toronto St. Michael's Hospital must quickly learn whether this competitive athlete's paralysis is temporary or permanent. The first step is figuring out what Chrissy can feel and where.
She's here, sensation to here, and nothing there.
The sophisticated neurosurgical arts don't get any simpler. An unfolded paper clip now holds the key to Chrissy's fate.
So you feel this?
Yes, pain in my leg, between my legs.
Is it sharp here?
Yeah.
What about here? Is it sharp?
I feel it.
Okay. What about here?
It's all numb there. I feel it.
Anything here?
Yeah, ow. In the middle.
Yeah, okay. Anything here?
Yeah.
Here?
Yeah.
This young athlete has clearly damaged her spine, but there's a glimmer of hope on Dr. Morellis's face. Some sensation change has been found. He'll need x-rays to prep for possible surgery.
Okay, so we're getting the films now.
You're going to go for more x-rays after this? I'm really worried about your back.
The chance that this young woman may never walk again is unacceptable for Dr. Morellis, a surgeon known for pulling out all the stops for his patients. He calls a top neurosurgeon at a nearby hospital who excels in spinal cord surgery. If Dr. Morellis can get to him, then Chrissy's got a fighting chance of running again. At Sunnybrook and Women's Hospital, excruciating minutes tick by for the father of 18-year-old Victoria Les. He's desperate for news of his daughter's condition.
You just got to give it sort of gradually.
So we're okay with it.
Just 30 minutes ago, Victoria was in a horrible car crash that left her crumpled and dangling from a seatbelt. That she has survived this far is a miracle, but the teenager's heart rate pitches higher while her blood pressure plummets. Trauma surgeon and leader Talat Chugtai needs to know why, fast, before Victoria is thrown into cardiac arrest.
You're sure you didn't take anything today, right? Because your heart rate is quite fast right now because the patient's blood pressure is low, and that only means one thing, that something has been torn, in other words a blood vessel or the heart itself, and they're bleeding. It could be a spleen laceration that bled and then stopped, a liver laceration, a lung laceration or something. Okay, you didn't take any medications or anything?
No, I haven't
Birth
taken
control.
that.
Okay, fine. The question still for me is, why did she have that low blood pressure initially, and why is her heart rate high?
Victoria could be bleeding to death internally, so the team must find the source.
First, I'm gonna feel your tummy for a sec. Does that hurt?
No.
No? Does that hurt?
No.
Does that hurt?
Yes.
Yeah?
Am I gonna live?
Well, we're doing a lot of tests and a lot of people working on you to make sure you do, okay? But we got to figure out what injuries you have, because you have probably a few.
The pain that Victoria reports has the team start the hunt for internal bleeding with x-rays and ultrasound of her entire body.
Okay, honey. I know.
Okay, sweetie.
Stay like that. Don't move.
X-ray.
No blood there. Heart's pumping well and fast. No blood in her abdomen.
As hard as you can. Okay.
Oh! Oh!
Where?
Where does it hurt?
Spine tenderness, so she may have the spine fracture also.
They found the cause of Victoria's high heart rate, excruciating neck pain, but this is not good news.
So cervical spine, of course, is very dangerous because, you know, your respiratory and cardiac system gets supplied by nerves from the high cervical spine. At worst, you die from a high cervical spine injury, but we're always worried that what happens to the pieces of bone, you know, does it displace into the spinal cord? And at best, you're, you know, sometimes paraplegic, if not quadriplegic.
Dr. Chugtai must find out whether lethal bone shards are cutting into Victoria's spinal cord.
So a lot of work up to do on her still.
If they are, Victoria could be moments away from paralysis, or much worse, death. Back at St. Michael's Hospital, 16-year-old Tim Malingus lies fighting for his life. In a freak accident, a piece of metal flew out from a punch press, piercing the teen's neck like a jagged bullet. The trauma team rushes Tim to CT so they can locate the precise location of the fragment and repair the damage to his neck before he bleeds to death.
Yeah, let's get him over.
Trauma team surgeon Dr. Ahmed joins them.
Okay, so, sir. Yeah. What happened there? So you're here?
Yeah.
Let's just go to the operating room. We'll take a look in there and try and repair what's bleeding.
You gotta put me out though, right?
Yeah, you'll go through this lane.
Okay, thank you.
All right.
This is the sharp object.
They get their first glimpse of what they're up against.
I want to outline the sap clay again.
Go up even more.
No, like, yeah, go down.
Yeah. This is the area more at the bottom.
Okay, what's it look? Anything, guys?
We are looking to.
Difficult to interpret because a piece of shrapnel that causes the beam to scatter and.
They know there's continued dangerous bleeding, but this scan doesn't tell them why. The metal that ripped into Tim's neck has foiled them. It's deflected the scan's rays. The CT image is clouded and can't be trusted. The team is now blind to the extent and precise location of the damage.
Maybe someone will get his family.
Dr. Ahmed has no choice but to embark on a surgical fishing trip through Tim's neck. Not only must she find and remove the shrapnel, she must also find the bleeding vessel and repair it before it's too late.
Listen, Tim, have to go in here and get that little piece of metal out. All right, have to make an incision. Well, not right now. Upstairs in the operating room. You're going to be out, okay?
Alone, terrified, and fighting for his life. This is no place for a 16-year-old boy. In St. Michael's trauma room, another young person's future hangs in the balance. The team tries to reach a spine surgeon in a last-ditch bid to save Chrissy from paralysis. After surviving a fall from a collapsing deck, her only hope is that her spinal injury is not complete. If it is, this vibrant young athlete may be paralyzed for life. Time is running out. While Dr. Morellis tries to reach spine specialist Dr. Rampersad,
Let's get Dr. Rampersad for me. Where do they want it?
Dr. Chen and his team get Chrissy to CT to get as many images as they can for the surgery ahead. For spinal surgery to be effective for Chrissy, it must be done within a 3-hour window of the accident. 40 minutes has already passed, and the window of time is rapidly closing.
That's what I'm saying. We still can help her, so that's why we could at least give a try.
1, 2, 3. Big bump. Good for you.
Downstairs, the call is not going well.
They gotta accommodate. They gotta find a way to move people around, put some floor person somewhere else in another floor. She's young.
Intermediate or major doesn't do. She doesn't have any other issues. No. Poor chicken.
I think she's had an axial load, and
She has definitely a burst of that.
You want to look at films? Vertebral bodies look like boxes, right? So it looks like a box, looks like a box, looks like a box, looks like a box. That's good, and this does not look like a box. The way you get this is what the radiologist called axial load. So if you turn your spine to this, and you push it in this way.
Yeah. Excellent. Okay, thanks. Good job. Thanks, bye.
Success. He got the spine surgeon to take Chrissy. With impressive speed, just 50 minutes after Chrissy and her boyfriend fell with a collapsing deck. She is now on her way to surgery. The other hospital is just 5 minutes away, but with Chrissy's ability to walk on the line, it will be the longest drive of her life. Less than an hour ago, Chrissy Molnar arrived at Toronto St. Michael's Trauma Unit with her future on the line.
Here, my parents are here in Toronto.
A weekend visiting family turned horrific when this long-distance runner, voted Athlete of the Year at her college, fell with a collapsing deck that came crashing down on her spine. The trauma team doesn't yet know whether Chrissy will be paralyzed for life. They hope her injury can be reversed. So she's rushed to a nearby hospital, specializing in the kind of spine surgery that could make the difference between Chrissy running again or living in a wheelchair. They get Chrissy to Western Hospital in 5 minutes, but the surgeons there are shocked by what they see.
So when we opened up her spine in the back, we could see the one vertebra jumped over the other vertebra. It stretches the spinal cord. With that also it gets compressed by the shift of the spine. So functionally the spinal cord is a complete injury, because this is a devastating injury, especially to somebody her age. The infamous question we always get asked is, will I walk again? And because she has a complete injury, it's very unlikely that she will regain enough function that she can actually walk.
Her surgery finished, Chrissy rests in recovery. When she wakes, this vital young woman will be told that she will never be able to walk again. Over at Sunnybrook and Women's Hospital Trauma Unit, the team has just discovered spinal tenderness on 18-year-old Victoria Less, the victim of a brutal car crash.
She was sleeping on the way home, and then he also fell asleep.
Dr. Chugtai fears the impact of the crash may have cost her the use of all her limbs.
If we don't touch you, are you having a lot of pain anywhere? If we don't touch you?
Just my neck and my arm.
Neck and your arm? Okay. We have to put a tube in through your nose that's going to go into your stomach eventually. You got to help us out with that one.
Okay, this is uncomfortable, okay? I'll tell you right now.
Only a CT scan can reveal how severe Victoria's injuries really are. In preparation, the team needs to get a nasal tube with contrast dye into her. This is a risky procedure. If Victoria moves too much, she could cause irreparable damage to her spine.
Just try and relax, okay?
With the contrast dye now safely on board, they'll take her for a CT to hunt for internal bleeding and spinal fractures. The team gives young Victoria what little comfort they can before the trip upstairs.
And I got away with my boyfriend. It was the worst day in my entire freaking life.
Dr. Chugtai hopes Victoria won't become one of those devastating cases that makes treating young patients so agonizing for him. At St. Michael's Hospital, the trauma team races to help a 16-year-old boy whose life hangs in the balance after a chunk of shrapnel flew into his neck. The team can't see the damage with any clarity on CT scan, so they'll have to do what they're loath to do, open his neck wide and hunt for the shrapnel and damaged vessels. Blood pumps out of Tim at an alarming rate, so they've got to succeed before the last drop of life bleeds out of him.
And it's bleeding a little bit more briskly than it was before. He's lost a fair bit of blood, and so we've got to move a little bit quickly. And I was in the OR holding my finger on the bleeding while the anesthetists were putting the patient to sleep. A little bit uncertain going into the operating room what we were going to find.
Open exploratory surgery is now the only option to save his life.
Okay, so I don't really know what you've done here. Can I have a pair of forceps, please?
With Tim's neck opened up, he is now at risk of losing more blood than the team can replace. The neck is a minefield of tightly packed vital nerves and arteries. One false move, and Tim's chances of surviving plummet. At Sunnybrook and Women's Hospital, Victoria has survived a high-speed car crash that left her small body crushed and dangling from a seatbelt. But the 18-year-old may never walk again. A devastated father learns the possible fate of his young daughter.
Might have been totally dependent on people to get through the rest of her life.
A startling discovery is made, and it's not what they expected. Dr. Chugtai sees for the first time what is causing her pain and high heart rate.
Wow. So I didn't think it would be that bad or that high, actually.
There's more. Hold on that side.
Victoria's neck is broken, and not just in one place, but in 7 different places.
You can see that there are many areas here. Here's one on the lateral aspect of one of the spines. Here's another fracture here. You can see just how significant it is here. There's a fracture here and here, so this cervical vertebrae has 2 fractures in it. There's fractures everywhere.
Miraculously, none of the many bone fragments went back into Victoria's spinal cord, but they still could, and if they do, she could lose all feeling in her limbs or stop breathing altogether. The team must get Victoria immediately into a neck-stabilizing halo. 4 posts will be drilled into her skull, and her body must be fastened to a brace. They hope by immobilizing her for months, she will be saved from a lifetime of devastating paralysis. At St. Michael's, surgeons struggle to stop Tim's blood loss. The 16-year-old has a shard of metal from an industrial accident lodged in his neck. And Dr. Ahmed delicately navigates her way through a sea of vital arteries and blood vessels.
Pretty deep.
She's surprised how deep they have to go to find the ballistic shrapnel.
There you go. There you go. There it is. Cool, eh?
The team examines it. Its shape and position in his neck will help tell them what type of damage it has left behind.
Very close to brachial plexus territory.
The window starts to close on how much time Tim has left. Hunting furiously, Dr. Ahmed finds the first damaged blood vessel. The metal caught Tim's external jugular vein and cut it in half. She works rapidly to tie it off, but must sacrifice it completely. Then she gets her next surprise. Tim's internal jugular vein was also cut, forcing Dr. Ahmed to repair this one as fast as she can. To her relief, the bleeding stops.
Good. That looks better already. I have a say in the operation's not open until the patient leaves the hospital, but for now I'm satisfied.
Time to close, and just in time for Tim. It looks as though this young life may have been spared. Having just moved to the city with his family, 16-year-old Christian Ballesteros goes to a local mall and suddenly feels the piercing blade of a knife in his back. The grade 10 student is rushed over 30 miles to Sunnybrook's trauma unit. There, the team must discover whether the knife slashed this teenager's lungs or heart. A typical teen trip to the shopping mall may have turned deadly for 16-year-old Christian Ballesteros.
Christian, 16 years old. He was stabbed once by an unknown length knife in the back. It's on the right-hand side, high thoracic.
No, just my back.
Got it?
Yeah.
Because he was with me. He just left.
Right.
Asked money, and he said, "Okay, Mom, I'm going."
Okay.
And then after a while, we received a call from the police.
Right. Let's just take this. Thanks. Hey, how are you? What's your name?
Christian.
Christian. You having any pain anywhere?
Just the back.
The back. It came at you from behind?
Yeah.
So, could have affected anything, both lungs, the heart, the aorta. You're not getting dizzy or anything, are you? You let us know, okay?
Right now.
The wound now bleeds into his chest at a rate that could crush his lungs. They'll need to decompress this fast with a chest tube.
This is a temporary thing that worked very well that probably saved your life. We're going to put another tube in here, okay? We're going to put a tube in.
There's no time to get to an operating room, so trauma team leader Dr. Chugtai orders the team to cut Christian open to insert a life-saving chest tube.
We're going to freeze, okay? We have some xylocaine.
The hope is that the tube will release enough pressure to stop the teenager from suffocating on his own blood.
Dr. Cordella. Quick assessment here showed a punctured right lung, so we put a chest tube on the right side to get rid of the air and let his lung expand again.
Chest tube is in and draining blood.
The tube works, but it's not over for this young man.
Well, we need to rule out a heart injury as well.
The team must see the wound to understand what they're dealing with.
Okay. Oh, this is a huge. What kind of weapon was this?
I don't know, it's a knife, I guess.
Knife. It's like an axe.
Right there.
The wound is deep, so deep that it has trauma surgeon Dr. Chugtai convinced the knife must have slashed the teen's heart. The doctor has seen patients like Christian die in mid-sentence on the table before. Time is of the essence. Outside the trauma room, his mother, father, and little brother await his fate.
We're going to take a look at your heart now, okay? So we're looking for any fluid around the heart, any blood around the heart. If there's any blood around the heart at all, he needs an operation to check what in the heart is injured.
Whether Christian will live to graduate high school is anyone's guess. In another room at Sunnybrook and Women's Hospital, 18-year-old Victoria's fate hangs in the balance. A high-speed car crash has fractured her spine in 7 places. Dr. Chugtai reviews the films and likes what he sees.
She has multiple fractures in the spine. It's relatively well protected in the middle there. Nothing is retropulsing into the spinal cord and causing compression. So she's actually very lucky. We've already had the spine surgeons put her in a halo. The halo will be for weeks until things heal properly.
I think it's 7 vertebrae was broken in my neck.
Functionally, it's going to take a lot of rehab and recovery for sure. With all these spine fractures, I mean, she'll be in this halo, she'll be in a brace, she won't be mobile, but lucky to be not paralyzed, lucky to be alive, yes.
I didn't think I was going to live because whenever I think of neck injuries, I associate it with either being paralyzed or breaking your neck, which causes death. So I was really nervous. I didn't think I would make it this far, but people always say, like, you don't think anything could happen to you, you always think you're lucky. And I was definitely one of those people, and this was definitely something I never thought I would have to go through in my life. But things happen, so.
Young Christian fights for his life in the Sunnybrook Trauma Unit. A tube in his chest is the only thing keeping the 16-year-old's lungs from collapsing. But this is only part of his problem. The knife attack that's landed him in this trauma unit may have hit his heart.
It seems between. So let's see the lumen in the middle? Yep. We're going to take a look at your heart now, okay?
Rather than risk a long trip upstairs to CT scan, they'll ultrasound his chest. If they find a puncture, Dr. Chugtai will have to open Christian up for heart surgery right away. But there's air from his punctured lung blocking the view. Has Christian's heart been punctured? Could he die suddenly on the table? The team still doesn't know. But with the position of the wound, it's unlikely this vital organ has escaped unscathed.
Tell them we have a stab wound.
They have no choice now but to risk precious time with the trip to the CT scanner to solve the mystery of the huge knife's trajectory.
A big knife like that in the back, we could be operating on this guy or he could be dead at the scene.
Things are grave enough for the young teen that Dr. Chugtai knows he's got to talk directly to Christian's family.
So I'm Dr. Chugtai, I'm one of the surgeons working here on the trauma team. When he came to us here, he was having some trouble breathing. Things were a little bit dangerous, right? You have the heart and the lungs and the chest, right? So we're worried about that, okay?
I want to see him.
Sure, you can see him.
Yeah, can I?
Yeah, you can see him. We'll go and see him. I'm going to see your brother, okay? He's been hurt.
I know it's not your fault. Just be strong.
I'm so worried.
I didn't see them.
Do a quick CAT scan, okay? Lie nice and still.
This CT scan is vital for Christian's future. It will reveal the extent of the internal damage and show the team how they will need to proceed.
Money here is the CT scan of the chest. So we'll even show you the tract of the knife and tell you maybe where it stopped or where it ended.
Doctors can't imagine how a large knife could enter this young man's back so close to his heart without puncturing it. The CT scan will finally reveal the answer.
So see guys, you can see the tract of the knife. So as you can see, the stab wound went in the back and then it kind of went that way, so it didn't go straight into the heart. Probably went into his big muscles of the back because he's a young guy, and then did end up puncturing the lung, but probably went like that. You can never tell just by looking at the outside. Okay, perfect. We're done. Looks like we'll be able to admit him with just a punctured lung and a chest tube for that, so he's pretty lucky.
The 16-year-old's young and strong back muscles guided the knife away from the heart.
Yes, the difference between him making it out of here in a couple of days and not even making it to the hospital is just a matter of millimeters. The most gratifying aspect is speaking to families and you're able to tell them they're fine, they're going to go home in a couple of days. There's no greater feeling than seeing the look on that family's face, and it almost offsets the cases that don't go well. Unfortunately though, life is such that the cases that don't go well are humbling enough that you never ride the high of the good cases. So
downstairs, the victim of yet another horrible accident is rushed to the trauma unit. 53-year-old Pat Sabaru was driving her young visitors home when a driver in the oncoming lane smashed into them.
Any problem breathing?
No.
Were you driving or what was going on?
I was going northbound and I saw him coming over in my lane and he came straight on to me.
Driving up her street with her daughter and her toddler grandson in the car, a driver swerved into their lane and caught them head-on.
Do you remember everything though, eh?
Yeah.
Didn't lose consciousness, was anything?
Trauma team leader Dr. Tien is called in to quickly assess this grandmother's gruesome wounds.
We're gonna get some antibiotics in there. We're gonna clean off that disc, okay? We're gonna irrigate it with and then we're gonna resplint it.
Pat's wrist is open wide, with bone projecting out at an alarming angle. But before this fracture can be treated, they'll have to sterilize the massive wound right away. It's a direct line for galloping infection, a potentially deadly situation, even with the best hospital care.
Head on? Yeah.
It's not concern for herself that's foremost in her mind now. She needs to know the fate of the young people in her life, her daughter and grandson.
You have your daughter and your grandson in the car too, you said? Yeah, they're here with us. I don't know, I was just going to see, do you know if they were okay? Do you know what happened to them? Okay, I'll try to find out for you, okay?
At Sunnybrook and Women's Hospital, trauma staff try to contain a galloping infection in Pat Sabaru, the victim of a head-on collision.
because there's no strength.
Her wrist cracked open. Doctors raced to keep bacteria from killing her.
Perfect, Pat. You're just going to have a little relaxed time now while they're fixing these fractures, okay? Just relax, okay? I've got this jewelry. Just, I'm going to take this. Yeah. Thank you.
The team has done what they can to contain the infection, but more importantly, they have news on her daughter and toddler grandson.
Yeah, just to let you know, the police officer just told us that your two kids in the car? They're both fine, okay? They're all fine.
2 weeks later, Pat is still in hospital, recovering from a number of painful surgeries.
Yeah, I had so far 2 done, and I'm waiting for another one. Like, I got a fractured wrist, a fractured left leg, I have a broken clavicle, and I'm waiting for surgery on my knees now.
Although her injuries are extensive, Pat hopes that soon she will be well enough to go home and be with her daughter and grandson again.
I hope so. I hope to get better. I'm not going to stay like this.
Weeks after trauma surgery saved him, 16-year-old Tim Malingus looks back on a harrowing episode in his life.
It could have killed me. And I think about that every day.
A day at work almost cost him his life. Metal flew off a press and ripped into his neck. He nearly bled to death. Surgeons had to dig for the shrapnel and repair his jugular.
I was thinking about putting gold around it, making it a ring.
Only for the young would near death become a trophy experience. It's been 3 months since Chrissy Molnar lost the use of her legs, the victim of a collapsing balcony deck that crushed her spine, changing the course of her future. Now this former long-distance runner contemplates a whole new life ahead of her.
As soon as I got in here, I wanted to get into the gym and start working out again, I wouldn't let the nurses keep me in bed. I was always up, trying to get down here and working out. I wanted to get independent as soon as I could, getting in and out of my wheelchair from the bed, and then hopefully getting back to work in December. I've been looking into doing triathlons and that in a wheelchair, because I know there's a man that did the Ironman in a wheelchair, and instead of running, he used a racing chair. Instead of biking, he used like the reclining hand cycle. I probably wouldn't have been able to go to the Olympics before, but now, if I train hard, I probably might be able to someday, for Paralympics.
It's been 9 weeks since 18-year-old Victoria was the passenger in a high-speed car crash. It fractured her neck in 7 places, and it could have paralyzed her.
Today, Victoria's going to have some x-rays done to determine whether or not she's going to require further surgery to her neck. She's got about 3 or 4 weeks to go before the halo will be removed.
Any numbness or tingling in the fingers?
No.
No? You feel good?
Yep.
Yep.
Dr. Joel Finkelstein checks her x-rays to see how much longer she'll need to be confined to the halo.
So the x-rays look very good. I think we can take it off.
Today?
What do you think? Yeah. We'll take it off and put it into a hard collar.
Really?
Yeah.
It's healed enough?
I think so.
Oh my gosh.
Take it off at 3, so you're, so it's 2 months and 1 week. I think that'll be fine.
That's amazing.
It's good news, eh?
Yeah.
Surprising news. Okay. Generally, we can leave halos on for different lengths of time, anywhere from 8 weeks to 12 weeks. And she's young. People who are young, they heal faster. The alignment looks so good that all the things are in her favor.
Oh my gosh, it's bending. Yeah. That's what healthy necks do. I'm free.
A trauma that started as the worst day of Victoria's life has now ended, thanks to the trauma team, as a happy surprise that lets this 18-year-old restart her life.